The federal government is ditching a requirement for overseas travelers to provide a negative COVID-19 test before they fly to Australia. Key points. Greg Hunt says the move is in line with medical advice from the Chief Medical Officer. Greg Hunt says the move is in line with medical advice from the Chief Medical Officer. People will still need to wear masks when they fly and be double vaccinated. People will still need to wear masks when they fly and be double vaccinated. The Predeparture tests were introduced at the beginning of last year. Health Minister Greg Hunt said the government would no longer make it a condition of entry that people had to show they had tested negative for the virus before they travelled here. The change will come into effect on April 17th. Given that the vaccination requirements remain and the masking requirements, the medical advice is that the test would no longer be required, Mr. Hunt said. Particularly, as there are some challenges in some jurisdictions in having access to those tests or proving those tests. Mr. Hunt said he spoke to the chief executive officers of both Qantas and Virgin Airlines. But we also took the medical advice of the chief medical officer, he said. That was the view, that we progressively take away those items which are no longer required. Mr. Hunt will not extend orders under the Biosecurity Act, which allowed the government to make the test a requirement of entry into Australia. The pre-departure tests were introduced at the beginning of last year in an effort to stop as many COVID cases as possible from arriving in Australia. The government originally required someone to provide a negative PCR test result within 3 days of travelling, but that changed to a rapid antigen test late last year. Other countries, including many in Europe, have also begun to ditch pre-flight tests. M to mute, left and right arrows to seek, up and down arrows for volume. Watch 15 minutes 2 seconds 15 M. Will winter bring a COVID-19 onslaught?